Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What happens after Herceptin treatment? After Herceptin treatment, your doctor will monitor you regularly for cancer progression, advise you not to become pregnant for at least 7 months, if you are of childbearing potential, and test your heart every 6 months for at least 2 years, because there is a higher risk of developing long-term heart damage in people who take Herceptin. Seek emergency medical help if you're taking Herceptin and you develop any symptoms of heart failure. They include shortness of breath, trouble breathing, an irregular or rapid heartbeat, increased cough, swelling of the lower legs or feet. During treatment with Herceptin, your doctor will test your heart every 3 months. People who can become pregnant are advised to use contraception during their treatment period and for 7 months after treatment with Herceptin ends, because Herceptin may cause low levels of amniotic fluid in the baby that can lead to underdeveloped lungs and neonatal death. A long-term study that followed women with early-stage HER2-positive breast cancer for 8+ years, reported that adding Herceptin to chemotherapy significantly improved the overall and disease-free survival. There was a 37% improvement in survival and a 40% reduction in risk of cancer occurrence, compared to patients treated with chemotherapy alone. There was also no increase in the incidence of secondary cancers and only a minor increase in heart problems. In terms of overall survival, in people given Herceptin plus chemotherapy for breast cancer treatment, 6.78% more patients are still disease-free than those just assigned chemotherapy. The overall estimated median survival is 7.5% higher in the Herceptin with chemotherapy group. When Herceptin plus chemotherapy was given for metastatic breast cancer, there was 0.2.7 months longer median time to disease progression compared to the chemotherapy group, 0.2.5 months longer median duration of response compared to the chemotherapy group, 0.4.8 months longer median survival compared to the chemotherapy group. When Herceptin plus chemotherapy is given for metastatic gastric cancer treatment, there were 6.2% fewer deaths compared to chemotherapy. Treatment with Herceptin usually lasts 6 months to 1 year when it is used for early HER2+ breast cancer, or it is given until disease progression or intolerable side effects occur when it is given for HER2+ metastatic breast cancer or metastatic gastric cancer. Related questions: what are monoclonal antibodies? What are biosimilar drugs and how do they compare to biologics? How long can you stay on Herceptin and Perjeta? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.